Okay, so we'll just start there. So intubation, you have to be sedated,
Correct.
and then the larynx.
We use a laryngoscope is the tool we use, which is typically either surgical steel or a hard plastic leg. When the patient is prone, we enter the mouth. And we want to capture what it is. It's a sweep. We enter and sweep the tongue to one side, then elevate it. Once we do that, that kind of opens the airway up so you can see both the trachea and the esophagus.
Okay.
Now, the way we identify the trachea is we see the vocal cords, which are two white pieces of cartilage. All right. We're going to insert the tube between the vocal cords. And what we do is and there's a balloon on the tube, a cuff. So once we get that between the cords, we inflate the balloon.
Okay.
Then we start to assist the breathing using an ambu bag at first, of course. Then we put him on a ventilator. Now, here's the difference, what makes a ventilator so funky. We are a negative pressure system. We breathe passively. The only reason, we breathe is to get rid of CO2. Oxygen, because we're a low pressure system, as our diaphragm pulls down, air will pass. We drop our atmospheric pressure within our body, and the air will passively flow in. So we're a negative pressure system. What a ventilator does is a positive pressure system. So it could be uncomfortable, where we're actually putting air inside of the lungs, or oxygen rich air, and trying to recruit, open up areas of the lungs that may have consolidations or what have you.
Okay. So why typically do people go on ventilators?
Well, there's a number of reasons. The way their lungs can be so full of fluid. Their lungs, people with COPD from smoking, they have, we count on elasticity in our young lungs.
Okay.
Young lungs are very elasticy. Old lungs are like balloons that have been blown up 100 times, kind of sag bags. And right now with the coronavirus, what it is, they're getting it's almost like a fibrotic, a connective tissue type thing, and inflammation, which inhibits the people from breathing. Now, with positive pressure, we're forcing oxygen in, and it also gives us access with suction to clean some of the junk out.
Okay.
And one of the most important things for anybody and of course it's a pneumonia, so there's inflammation as well. So you can look online easily at like a cross section of a lung, how it works. They call them alveoli. There's millions of these little, looks like bunches of grapes of tissue thin sacs.
Yeah.
That will do the gas exchange. Put the oxygen into the blood and get rid of the CO2.
Okay.
So the left side of the heart gives us oxygen. The right side of the heart takes the oxygen poor blood, puts it in our lung, back in the lung, and the lung decides which is toxic and which isn't.
Okay.
And that's why we breathe, to get rid of that. Otherwise, we end up with what they call CO2 narcosis.
Got it. Right. Okay.
And
wow.
the best thing for anybody with consolidations is really drink, because you can thin, but this is a crazy thing. Like I say, it's not regular mucus.
Right.
And what mucus actually is dead white blood cells. Those are macrophage that are trying to eat the virus.
Huh. Okay.
And of course, so that's what, it's dead white blood cells.
Got it.
And, if you drink, you can pee some of that stuff out and loosens things up. The worst thing a person can do is not drink.
Okay.
And of course, you've got an inflammation component as well.
Okay.
But
so here's a question. So
all right,
people go on ventilators essentially to be able to be treated with medication, correct?
Well, they go on ventilators for respiratory support.
Okay.
And what we call pulmonary toilet, which is to give us access to the lungs to maybe, well, for one, you can get inside there and see what's going on with a scope.
Okay.
And for two, we can get in there with suction and try to clean them out some.
Okay.
So
okay.
it gives, intubation will give accessibility to the lungs, both with suction and visible.
Okay. So, I mean, if somebody comes in and they're, who's appropriate to go on a respirator with coronavirus,
Well, you know what? I mean, ventilator, with young people and there's something to save.
Yeah, right.
Yeah,
okay.
If it's going to get you over the hump and you need some assistance and you need pulmonary toilet to clean you out and stuff,
okay,
it does well. But somebody who is very elderly or very frail, compromised lungs already,
uh-huh,
I always call it, you prolong death instead of life.
Yeah.
Because you can't get them off.
Right. Yeah, I mean...
Then they end up being trached and,
Right, yeah.
So, I mean, my recommendation, anyone who is very frail and, like in my advanced directives, only save me if there's something to save.
Right. That's amazing, Michael, that you have that done.
Well, I don't want to linger.
Right. Me either.
It's no quality of life.
Yeah. How are you, you just retired from, how many years as a respiratory therapist?
A year and a half, and I got 30 years in. Just shy of 30 years. And I'm getting job offers like crazy, $15,000 a month to come work.
That's what I've heard.
By recruiters, and I'm not doing it. Work me like a dog, and
and also, do you think? I mean, you wouldn't want to contract the virus,
No, I you know what? I mean, I was watching this. On a good note, this virus is brittle. The only difference is between this, they say it's DNA based.
Uh-huh.
So therefore that virus is coated with a lipid, fatty, it's got a fatty layer on it.
Uh-huh.
So that's what makes it kind of hard to kill. That's why soap and water is the best thing.
Right, okay.
Because that will break down fat. Fat melts fat.
Right.
And, but when, people do get it in their lungs, shy of that fat layer, it's very brittle.
Okay.
So
basically just wash your hands.
yeah, wash your hands and drink, everyone should be carrying a water bottle.
Yeah.
Because what you want to do, if you do you have a speck of virus in you.
Uh-huh.
Your stomach has a pH of 2.
Okay.
And if that is majorly acidic, it'll take the paint right off a car.
Yeah.
And you get that virus down in your belly, it will kill it.
Yeah, okay. Wow. Thank you so much. This is a lot of really great information. I need.
Well, use me as a resource, because I'm not going back to work, but this can be my way of,
yeah,
giving back.
100%. I'm trying to give people appropriate information about ventilators. So it's been a while since I've worked in the ICU, probably since like 2012 or so. So I just need, and I never really got like an appropriate rundown of like exactly what respiratory therapists do. I mean, I knew kind of like how intubation works and why people would be put into comas and, whatever. But it just at this time, it's like trying to advise people like, should you go on a ventilator, and I don't know if like we're pausing, if, if it's happening so fast, we're not pausing, to still honor people's end of life wishes. Like, why can't I say like no ventilator, comfort measures only? It just seems like they want to put every fucking person on a ventilator, and it's like, why? It's awful.
You know what? You know something? They want 30,000 ventilators in New York. There's not 30,000 respiratory therapists in the whole country to run these things.
Yep.
And the doctors are stuck, this is a United States thing. They are obligated, and somebody without advance directives, to do everything they can to preserve life.
Right.
So they're going to take 85-year-old grandma who's already knocking at death's door and has a lot of, and they're going to put her on a ventilator.
Yeah.
And it will keep her alive.
Right.
But chances of her ever coming off aren't great. And you know what you ought to buy? And they're very inexpensive. Are you familiar with what an oximeter is?
No. Oh, the pulse ox?
The finger.
Yeah. The little thing you can get them. You can buy them.
Yes.
You put them on their finger and they read your oxygen in your blood.
Yeah, it'll give your oxygen level and your. When you see people, if someone is under 90 or actually under 88%, that's what makes you qualify for home oxygen.
Right.
You know what? You could buy one for $40 off Amazon.
Yeah.
And it'd be a nice tool to have when seeing people and seeing where they're at.
Okay. That's really helpful too, just for people who are like at home with their elderly, parents. And also, hospice can deliver, at least oxygen machines that they can have at home. So that might be something that can help. And then, helping them die comfortably. Because I'm just having a huge problem with like our biggest, like our first offense is to suddenly just fucking intubate and treat everybody. And it's like, I get it. And like, honestly, you're right. This is a huge problem with advanced directives, but we need to be making better end of life decisions here, because that's what this is all about. That's how we're going to save money doing this, and honestly be ethical, about it.
Well, you know what? This could put a family into ruin.
Right.
Financial ruin.
Yes. I know.
ICU, you're there for 30 days. You run up $1 million bill.
Oh, my God.
And the way we decide to intubate somebody is, and this is a big part of my job, this was our specialty. And we draw arterial blood gas. Now, no one touches artery. You've got millions of veins. You've got probably 24 arteries. Mm-hmm. And you know what? You could give someone a stroke by drawing these. And I used to do them all the time.
Wow.
And what we look for is high CO2. Mm-hmm. And that's why they call it ventilator. A ventilator really is to blow off that CO2.
Yeah.
Now, a big thing is they call NIPV, non-invasive CPAP machine, basically, but just a good one. Where we seal a mask on good to give someone ventilatory support.
Okay, yeah.
And blow off CO2. That's non-invasive. That's a very good thing.
Okay.
If you can get in that window,
okay,
you could bring someone back.
Okay.
That I recommend.
Okay, that's good to know. So that's like an option, is like getting the CPAP mask and doing it that way. And that can be done at home too, right?
Absolutely. Actually, they call it BiPAP because it ventilates.
Okay.
CPAP is constant positive airway pressure.
Okay, BiPAP.
BiPAP is a multi-level that inhales and exhales as well to get that CO2 toxicity.
Right, okay.
We call CO2 narcosis.
Got it. That makes total sense. So, yeah, okay. So,
and an easy way to check if someone's oxygenating, look at their nail bed if they're pink. Press on a finger for 3 seconds and then take your thumb off. If it doesn't pink right up, it stays white for a while. Should pink right up, you know that they're oxygen deprived.
Okay, cool. Thank you so much. That's a really good thing. I'm going to talk to hospices with, my clients on it to say, here's a few other options, that we can try instead of taking someone to the hospital or whatever.
Yeah, and I would recommend buy an oximeter, and it'll be a great tool.
Okay. Thank you.
And it's not something you got to be a licensed professional to do. You can find nomograms of, where you want numbers to be. Mm-hmm. And, like I say, below 88 is the magic number for oxygenation, where a person requires...
okay.
Because below that, that's when tissue death begins.
Okay. Okay. All right.
And think of me as your consultant. Just call me. I got nothing else going on. Just gives me something productive to do.
I so appreciate your knowledge, Michael.
Oh, hey, I'm glad I'm able to use it.
Me too. This was very important for me today. Thank you so much. I'll give you a guy. We should do like a Zoom or a FaceTime or something later before you guys take off.